Located in the upper right side of the abdominal cavity, the liver plays a vital role in managing the body's chemistry. In a healthy liver, millions of cells process the products of digestion that have been absorbed by the blood. The liver also filters out toxins and waste products. Liver functions can be compromised by different factors, including alcohol intake, genetic disorders, infections such as hepatitis C, and cancer. Every year, more than 1 million new cases of primary liver cancer develop worldwide, and at least 200,000 new cases of secondary liver cancer result from primary bowel cancer. Radiation is an effective treatment for destroying cancer tumors, but in high doses it's dangerous for healthy tissue. Scientists and medical doctors at Sirtex Medical have found a way to irradiate tumors in the liver while minimizing radiation to healthy tissue. The procedure is known as selective internal radiation therapy, or SIRT. The procedure takes advantage of the fact that the tumor derives all its blood supply from the hepatic artery. By using the hepatic artery, tumors can be selectively irradiated with much less effect on the normal tissue. The radiation is delivered by small, biocompatible microspheres called SIR spheres that are about 1/3 the width of a human hair. They contain beta radiation emitting yttrium-90. The spheres are injected into the hepatic artery, where they travel in the bloodstream to the tumor. It's not necessary to know the number or location of the tumors, as the SIR spheres will target them regardless of where they are. They lodge in the small vessels of the tumor, where they selectively deliver high doses of radiation to the tumor and the neovascular blood supply of the tumor.
The liver itself is an organ that's very sensitive to radiation. Traditional external beam radiation and even the most cutting-edge, state-of-the-art conformal radiotherapy has a very limited application for cancers in the liver. Microspheres can treat various portions of the liver to very high doses of radiation and yet not injure the normal segments of the liver.
External beam radiation, if you went to your local radiation oncologist, he could only give the liver approximately 25 to 30 gray, gray being a measure of radiation absorbed. This therapy, we estimate, gives approximately 200 or more gray to the tumors and minimal amounts to normal tissue.
You know, when the procedure first came out, we were brought into most of our patients' lives very late in the disease. So a lot of them had experienced some other form of treatment, whether it was radiation or whether it was chemotherapy, and they said that this was it was very mild compared to what they had been through.
Chemo created some side effects, so nausea and that sort of thing, quite a bit of nausea actually. You get poked and poked and poked, and this was almost as if, you know, it was a gentler way of achieving maybe the same thing, maybe achieving better results.
We provide an initial consult, and patients will bring in a recent CAT scan. They also bring in recent clinical notes from their doctors, recent lab work and biopsy reports. And in this initial consult, the interventional radiologist, he's trying to see if they're a suitable candidate. If those things look preliminary okay, we have the patient come in for an angiogram. And what we're looking for is to see basically a couple of things. We're looking at the blood supply to the tumors. We're also looking at the patient's anatomy. Everybody's anatomy is different. Some patients their arteries are straight or crooked, and some patients even have additional arteries that we just need to be aware of.
If there's alternative circulation paths from the cancer that goes to other areas of your body, say your lungs or your stomach or something else, then the procedure is not possible because the radiation beads would go to that part of the body also. I was fortunate enough that mine were contained in my liver, and so that was another positive step that said yes, we could do the procedure.
I think it's important for people to understand that this is an outpatient procedure. They come in the morning, we perform the embolization of the microspheres, they recover for 4 to 6 hours and are discharged home the same day. That's fairly unique to this procedure.
We have our patients come in approximately 2 hours before the procedure time. They're told, of course, nothing to eat or drink the night before. We have found from product literature and just from other sites that patients can get nauseous with the procedure. So we order them an anti-nausea medicine, which they'll get in the IV when they get here. We also give them a steroid. That's also to help so that they won't have a bad response. So when a patient comes in, they go up to our short stay room. We start IV. We ask them questions, about their allergies and their history.
It's routine for lab work to be taken before the patient is moved to the angio suite.
Then they'll be brought into the angiography suite, placed on the angio table, and the groin washed with betadine and sterile drapes placed over them. This is to ensure sterility so no infections occur. The interventional radiologist will then come in, and then I'll numb up the groin. They'll feel a pinprick, some burning, and then the groin will go numb. I'll then put a needle into the artery and then put the catheter in the artery.
Catheter insertion takes approximately 30 minutes. The physician will take some angiograms to ensure that it's properly placed.
During this time, they will be given some intravenous, what's called conscious sedation. These are drugs that take the edge off, keeps everybody calm, makes them very sleepy. Doesn't put them out like general anesthesia, but it just basically makes them not care what's going on.
I had a few choices. I requested the least amount of medication as possible so I could be alert through the procedure. They said that would be possible.
Once the catheter is placed correctly, the Sirtex dose and delivery set is brought into the suite. The box is then set up. Once complete, the catheter is attached.
When the Sirtex are injected, they won't know it. They won't feel anything, except when contrast is injected and an arteriogram is performed, they'll feel a warm feeling over their abdomen.
How you feeling, sir? Things are going real well, okay?
I've had a number of other things done in remedying the cancer, but I would say that this was the least painful, to the point of not being painful, and nothing to dread. Again, it might be that if I had to do it again, I would.
After the dose has been safely delivered, the catheter is removed from the patient and the femoral artery is sealed. The incision will leave a small mark on the groin area.
It's cold here.
The area is cleaned before a bandage is placed over the incision.
All this betadine off you.
Medical staff will provide the patient with information on how to properly care for the area.